Pharma companies are expected to submit plans to the Trump administration today for voluntarily lowering drug prices. Angelica Peoples joins us right now with more on the deadline that's approaching and what's happening behind the scenes. Angelica, what are you hearing?
Yeah, Becky. Well, so far we haven't heard companies making many concrete promises. Most are telling us that they're in talks with the administration and that they don't have anything to share yet. We've heard a number of CEOs like Lilly's Dave Ricks and just last week on your show, Merck's Rob Davis, say that they agree with President Trump that other countries should pay more for drugs, but we haven't seen much to actually raise those prices elsewhere. Now, Lilly and Bristol Myers Squibb those are some of the companies making a few tweaks, but nothing groundbreaking. And that's in part because you can't just jack up the prices in places like Europe on a whim. They have controls in place there. We have seen more moves around Trump's call to bring drugs directly to patients at lower prices. So Bristol last week making its psoriasis drugs Sotyktu available at more than 80% below the list price. And this morning, the industry's main lobbying group saying that it'll create a new DTC website that'll aggregate medicines from its member companies at those lower prices. And we'll see if that's enough, right? This administration is very focused on most favored nations. And just last week, HHS sent a proposed drug pricing pilot program to the White House for review. And we're hearing that there could be more in the works. So much more to come, Becky.
But again, this is the drug companies trying to look at ways to say it's not us, it's the middleman. That's where you have to do it, and that's why they would set up a DTC, a direct-to-consumer website.
That is certainly one way to do it and say that if we just go directly to the consumer, for example, with that Bristol drug, we can cut the price by 80% and hear consumer. But again, the question is, how many people are really going to pay for that? So if you do the math on that drug, for example, it's still $16,000 a year out of pocket. And again, the companies will say, well, this is where insurance needs to be fixed, right? This should be a drug that's covered. You don't have any copays, and this is what's wrong with the system. So it's certainly one way to say that we have an answer without the companies themselves necessarily actually lowering the amount of money that they're taking in.